For some hospitals, they're cutting services as they try to stay financially afloat. One of the most common services to be cut is the maternity ward. I mean, this is the United States of America. This should never happen here, but it is. The Commercial Appeal reveals another big problem with America's rural hospitals, and that is what people are doing when the hospital is no longer available to treat patients. What do? Listen.
Where we're in trouble is after the doors close at 5 o'clock. And for folks that used to use the emergency room for treatment, now they're using the ambulances for treatment. But what if you're having a heart attack here and you're 30 minutes away from the closest medical facility in the evening? Now, in the daytime, we can probably take care of it with fast pace, with our regular doctors that are here. Now, they can probably stabilize you to get you there. But after hours is the problem.
So people are using the ambulance. They call 911 for medical service when the hospital's closed at 5 o'clock each day in some of these places, which brings me to another huge problem that nobody's talking about, and that is this. Ambulance services are going bankrupt all over this country at an alarming rate. Did you know that? Now think about this. When do you think about the hospital or the ambulance? Well, if you don't work there, then it's something you think about when you need it, and that's about it, in an emergency. And the issue is this. The healthcare emergency of closing hospitals and ambulance services is something that almost nobody is paying attention to right now. And for communities that were receiving massive amounts of COVID money during the pandemic, that money has dried up. And with that comes tremendous financial pressure on those hospitals that were surviving from the government handouts. And it's not just healthcare that's affected. The loss of these hospitals ripples through the communities because it can be a death knell for the entire region, especially one a long way from anywhere else, because it rips the foundation out, takes it with it. Listen.
But in a broader sense, it also means that there will be a lack of economic development related to access to healthcare when people just don't choose to live in a community where they can't access care or have a baby or activities like that. So what we find in most rural communities is that the hospital is an anchor for economic development all throughout the community. So the hospital closes, the pharmacy closes, the grocery store closes, and then the community just kind of falls down.
It kind of falls down. The whole community just kind of falls down. The problem is not just emergencies, according to those on the front lines of this emerging healthcare problem in America. You see, people that find themselves without a hospital that's convenient, well, those folks often decide not to seek out normal tests and screenings and, hospital and doctor visits. I mean, if you go from having a local facility to having to drive an hour or more to take a day off from work or take a kid out of school for the day just to get a physical or mammogram or colonoscopy, well, a lot of folks just say, well, it's not worth it. I don't want to take a day off from work. I don't want to take the kid out of school. I've got things to do. As a result, people are dying from preventable illnesses at a far higher rate because they never got that screening. They never took the physical. That lump in their neck or their armpit or wherever was never evaluated. Here's more.
And the data shows that actually after a rural hospital closes, mortality rates increase by 8%. So it's a danger to the community, especially when you're having a heart attack or a stroke or a loved one is going through that. With regard to non-emergency services, that's important too, primary care, obstetrical care, and when those things fall down, the community suffer.
Look, coverage of hospitals and ambulances really is the most important factor right now in keeping people alive. If the healthcare system cannot reach someone in time, then their likelihood of actually surviving diminishes incredibly, not to mention all the potential injuries that could be sustained long term if you do not survive a heart attack. Seconds matter, you see. Seconds matter.